Welcome to the Protecting Your Nest podcast. The P in the ROPE acronym reminds us that if we are to be healthy, we must not only add the right things to our body, but must also remove the things that can potentially harm us. In my training, I've learned that we are surrounded by many things that can be toxic to our bodies. There are so many sources of environmental toxins that can lead to the presence of toxicants in our food, water, and air. These sources can include organic and inorganic pollutants, pesticides, and biological agents, all of which can have harmful effects on all of us. For us to truly thrive, we need to have some awareness of these toxins so that we have a path to remove them from our bodies. That's why I decided to ask a functional medicine doc to join us to share some of her tips that will help us along our way. Today's guest is Dr. Wendie Trubow, who is an MD, MBA, and a functional medicine gynecologist who received her MD from Tufts University in 2000 and has been practicing functional medicine since 2009. She is passionate about helping women optimize their health while facing the many challenges they may face along the way. Dr. Trubow is also the author of her new book, Dirty Girl: Ditch the Toxins, Look Great, and Feel Freaking Amazing, which is an easy to understand field guide designed to help readers eliminate the invasive toxins responsible for the chronic conditions they live with. Her book was written to help us create a strategy to tackle the only toxic cleanse that really matters and come out on the other side heartfully, helpfully reformed, and squeaky clean from the long haul. So with that, Dr. Trubow, it is my pleasure to welcome you to Protecting Your Nest.
Great to be here, Tony. Thank you. Call me Wendie.
Well, let's go with that. And you call me Tony. And I'm really excited. And I don't know if you knew this, but you're my 75th episode. So
Whoa.
we're kind of having a little celebration today. And I
Yes.
can't believe that we've actually gotten to that point. Very exciting. And, I hadn't really focused on pollutants or toxins. And if we're going to truly protect our nest, we have to think about all of these things that can impact our lives. So that's why I'm happy you're here. And it's really nice to not only connect with the functional medicine mindset in my training, but also to have colleagues like yourself who can kind of share some of your experience. So I feel like I'm cheating because I'm getting extra credit right now. So loving that. And so with that, I know a lot of people who have been on my podcast have had experiences that have kind of led them to the work they're doing. And so I'm curious for you, what's your story? What led to you and your family really starting to focus on toxins and making sure you remove them from your life?
Yeah, it's always personal, right? So I I've been in functional medicine as a practitioner since 2009. I learned about functional medicine in 2006. I knew about it. My husband's always been into functional medicine and never did any traditional practice. He went right into functional medicine after residency. But it didn't click for me until 2006. I went to see his mentor who diagnosed me with celiac. That put me on the path of, okay, traditional allopathic medicine is amazing for surgical care, obstetrical care, and emergencies.
Yeah.
It's amazing for that, but it's not so good at actually getting us healthy. It's just really good at the stuff that needs surgical intervention.
Yeah.
And so when I had that epiphany that, my life is really about inspiring and empowering women to be the best selves that they can be and as healthy as they can be in all the different ways that they contribute to their communities, then it made much more sense to get into functional medicine. And then in functional medicine, we do a lot of work with toxins. And
Right.
so about 3-4 years ago, I really started to do more toxins testing. And then 2.5 years ago, my hair started falling out and I gained 9 pounds and I got a rash on my face. And let's gain 9 pounds and have half our hair fall out, said no woman ever,
No.
ever. And of course, I hit the roof. And it was actually right after my family and I came back from vacation in France. We went to France for vacation. I've like never really been to Europe, and we went to France right after Notre Dame burned.
Mm,
And if you read the news, you'll learn that Notre Dame, when it burned, released about 500 tons of lead dust into the air.
mm.
We didn't know that at the time. All I knew was it was super dusty in France, and we were like covered in dust. And I kept saying, God, it's so dusty. My sneakers are going to get ruined. And then came home and my hair started falling out and I gained all this weight and got the rash. And then started to do these tests on myself and figured out I've got lead and mercury. I've got 4 strains of mold mycotoxins, and I've got a whole bunch of environmental toxins. I didn't have glyphosate, which was shocking because I was like, I kind of had everything else. Why not that? But I didn't have that. That was one I did not have. But I had all the other stuff. And that really set me on this path to, okay, let's get this out of me. And when I got this diagnosis and I sort of put all the papers together, I looked at my husband and I went, oh, I'm such a dirty girl. And then I went, oh, we're writing that book because I'm the poster child for healthy living. And if I have all this stuff, what does the rest of the world have who isn't operating in the same way? I mean, I've been gluten-free and dairy-free and sugar-free and I exercise and blah, 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 right? I do all this stuff and I got all these toxins. So that moment when I said, okay, we have to educate people because it's, you don't even realize what you're getting exposed to in your everyday life.
Yeah, you gave me a flashback because one of my instructors with the University of Western States, she actually said the same thing. She said, I'm living this very clean life. And she did her test and she was like, oh my God, like what
Yeah.
is going on? So,
Yeah.
and so imagining, particularly in communities, underserved communities where there's struggle, they're living in environments that are not great, and imagine what their numbers would look like. And I just, it's amazing. You had to have your moment when your hair's falling. Now, for me, hair falling now is not a problem.
It's accelerated.
It's right. Exactly. Not sure I would notice, but I would notice the rash for sure. But it's real nice to know that there was a potential solution for you. And I also think about all the people who never get to those solutions, and
Yeah.
and it makes me ask the next question, which is, I definitely understand your husband kind of was in this space already, but the question is, you know, a lot of clinicians are not exposed to this way of thinking. So my question is, why is that? It just seems like
Mm,
it's so logical, but
yeah.
yet my conventional training, I'm not even sure if we ever used the word toxin. It just wasn't like used. So what's your thoughts on that?
Yeah, my thought is that there was a cut point in medicine and in how it was practiced that probably happened about 35, 40 years ago. I'm 51. So I would say it happened probably right around 1970-ish when pharmaceutical companies started to be able to have the technology to develop medicines for diabetes,
Mhm.
hypertension, headaches. And so as those medicines started to be developed, the focus really shifted from what I would say is traditional primary care of how do we get you eating well, and by the way, simultaneously, since 1970, more women have worked outside the home, and
Mhm.
so that's put some pressure on cooking, and simultaneously there's more ready-made meals. So now you have more medicine available, more ready-made meals,
Mhm.
and people who are just busier. And you put those together. Oh, and then the advent of the microwave so that you could get things quicker. So you put those things together, and the focus in medicine shifted from prevention to, well, I have this great drug I can treat you with,
Right.
and I can see you faster. And it takes less time to prescribe a medicine than it does to really counsel you and inspire you to make a lifestyle change. Because it's hard to make lifestyle change. Who are we kidding? It's really challenging. And so that was probably the point at which medical education pivoted. And when people learned there was a medication, then maybe they were kind of psyched, like, oh, I can eat my cake and my medicine too. And it got easier in a way. So
Yeah,
I think it's just
that
an
makes sense.
evolution that didn't really serve us in the end, but looked good at the time.
Yeah, it makes sense. I think about the functional medicine timeline, for example, and for those who are not familiar with it, just Google that, and this idea of going backwards and trying to figure out from birth, and even before birth, what's going on with people.
Yeah.
15, 20-minute office visit, which is where I'm recording this in my office, it's very difficult. And you have to be a real organized person to then somehow turn those 20-minute or 40-minute appointments into some information you can use to harvest that knowledge. So it does make sense. I know we live in a fast world, and I understand that. And there's perks of that, but the negative is that you miss a lot of things that you could have found. So, and I think about your family, you're beautiful. You have 4 kids, you have a husband, and you're trying to create an environment. And I think it was described as a beautiful, ecosystem to nourish
Yeah.
body, soul, etc. And it felt so good to hear that, because as my kids are, college age now, and I think about me and my wife and the environment you're trying to create, and just trying to be a little healthier. So that seems like, I'm sure it's a gradual process, but how were you able to create that once you kind of decided to focus on toxins, and the removal of toxins in your family? How did you guys make that kind of part of your way of living?
So let's preface it by saying I have teenagers, and so there's a line to how far I'm going with them, because I love and adore them and want them to keep talking to me. So I'm a huge fan of pick your battles, right?
Hmm.
So our home, when I got diagnosed with celiac in 2006, I said, if I can't eat it, I'm not serving it, and no one's going to eat it at my dinner table,
Mm.
because like the world is kind of a harsh place sometimes, and I'm not going to be left out in my own home. So I put that line in the sand, and I really feel fortunate enough to be married to someone who was like, okay, whatever. He didn't care. And so we've evolved to set certain guidelines, like, okay, we're not going to eat gluten in the house. And then my husband's always really been into food, so he's always like, how do we make it healthier and how do we make it less processed? And that's trickled into my approach too. So I was really, I have a partner in this. I'm not doing it alone. And then what we just started to do is level up, right? So we
Mhm.
leveled up our food a long time ago, and we continue to evolve it. And I continue to challenge my kids, like, I didn't raise you to be picky eaters. Put a bite of it in your mouth and chew it and swallow it, because you might find you like it, right? So having them eat healthy food. And then the cleaning stuff in our house, got rid of all of the stuff that's not so good. And I had grown up with stuff. It's called Simple Green. I grew
Mhm.
up with it. And my mom, when I was like 15, said to me, this is so healthy. It's Simple Green. And I believed her. And I never actually did any of the research myself. And I woke up about 8 months ago and I went, I don't think Simple Green's so clean.
Mm.
Those things that you don't even think about.
Yeah.
So I did my research and I was like, oh, yeah, this is sort of a relic from my childhood that I have emotional attachment to. I love the smell of, but it's no longer going to be welcome in my home.
Yeah.
So starting to create those things. And then as we need new furniture, we're getting furniture that doesn't have fire retardants and chemicals in it.
Mhm.
So we didn't go out and replace all the furniture in our house. We simply did it as we needed to. Whenever we need to paint a room, we use paint that has no VOCs in it. When I drove the contractor nuts when we did our basement, I was like, does that have VOCs? He's like, I don't know. I'm like, okay, well, you can't use it then. Go figure out until you can say no, no VOCs. You can't use it. So as we do things, we're making sure that it's healthy. And then the outside of our house, we have a tiny plot of land. We live in Newton, and the lot size is tiny. It's like a postage stamp. But we said, okay, how many plants that bear fruit and vegetables can we get into this tiny little area, and how can we maximize the use of our sun and our space? So we actually paid someone to consult with us and say, here's where you could put this, and here's where you could put this. So we added about 50 fruit bearing trees and bushes and to our yard. Plus we have a 24-foot by 4-foot garden. So it's kind of small,
Okay.
but it produces a lot.
Mm.
And what we've noticed is since we did that, we have a lot of pollinators and we don't spray anything. we spray like tea tree oil and
Mhm.
uh, sort of natural things. So we've looked at how do we make everything around us as natural as we can.
Mm.
You know? It's
That's
a process, right?
yeah.
My kids dyed their hair. I was so horrified.
Oh,
They dyed their hair, and I was like, okay, here's the compromise. You don't touch your scalp with it. It's at
mhm.
least a hand's width away from your head so that that stuff's not getting into you, and you do it in a well-ventilated room and you
Mhm.
wear gloves.
That's right.
And they were like, okay, fine.
Okay.
So, we're not living entirely toxin free,
Right,
but we've
right, right.
leveled up, right?
Yeah. It's a journey, and I always felt like there's levels to everything. So if I'm mitigating risk by
Yeah.
doing, 10 things, then I'll tolerate the two that are maybe not helping. There's a balancing effect. So I'm really good with that. I was laughing as you talked about how you were kind of laying down the rules. And I think that as we lead our children and coach them, and mentor them, it's okay to have some rules of engagement. I think that that's okay. And I think that parents shouldn't be afraid to do that. We have spouses that we collaborate with. We're trying to
Yeah.
achieve the same goals. I'm going to be a much better spouse if I'm healthy and feel good and able to be present. So I like that. And then I think about the labels on products, and
Yeah.
so many labels are, not, I wouldn't say the word deceiving, but they certainly are not expressing their truth.
Suggestive. They're
Right,
suggesting.
exactly. Thank you for giving me a better word. And I think that because of that, it gives people the impression that it's something that it's not. So I think that people need to just have a little bit more awareness when you look at products. And for certain things like cleaning products, you have to do more research. But look at labels, look stuff up, and go from there. But also, as I listen to you, and I think about the community, I grew up on the west side of Chicago, and it's a kind of middle income, lower income, and, many communities are exposed to toxins, maybe more in poor neighborhoods. I went to school in New Orleans at Xavier University again, and they have a history of some neighborhoods that really are unsafe in terms of exposure. And then I think about Flint, Michigan, right?
Yep.
Um,
Yeah. It's
Oh my
horrifying.
God, horrible, right? And I don't think that, and I'll be honest, I think I was watching the Michael Moore's documentary, Fahrenheit 11/9 or whatever it was called. And then it was suggested by sipping on the water, oh, there's nothing wrong with this water. And so, and again, I'm not, I don't want to make a political statement. I'm just saying that we can't allow our babies to be poisoned. So when you
No.
think about communities that struggle with resources, whether it's from bigger reasons or for smaller reasons, in terms of being able to reach those types of communities when it comes to, well, let me say it another way. If you had one of those kids from Flint, Michigan, walk into
Yeah.
your office and you had to take care of them, um, what would you do that's different than a conventionally trained doctor? How would
That's a
you
great
handle that?
question.
Yeah.
Yeah, that's such a great question. And I think let me back up one step because what I was going to say to you, Tony, was I think if it's hard for people to move. So if you go, okay, I'm going to assume that I'm living where I'm living. If you're living within close proximity to highways, you're getting exposed to a lot of
Right.
the exhaust and the fumes and the toxins from the highway. So okay, how do you mitigate that? Make sure that your window, well, it's like, well, on one hand open your windows, but on the other hand don't open your windows because you're getting that air. So then you would want to say, okay, let's get some high quality air filters into our space, especially the space we're sleeping in, because that's the space you spend a lot of time in. So filter your air and check your water. So I always see it like, don't fill up your pump with toxins and then make sure you do whatever you can to empty it out. So these kids from Flint, Michigan, first off, get them out of that exposure because you don't want to take a bath in leaded water. You're going to absorb it. So I would stop. You got to stop the exposure, A, and then detox the living daylights out of these kids. These are kids who really need high quality food. They need to be not eating a lot of processed stuff. And the reason is that when you eat that, it distracts the body from detoxing from the big stuff. So you just want to basically say, okay, all systems are focused on detox and not distracting the body with getting rid of artificial colors, artificial flavors, processed food, alcohol, sugar. That stuff is all a distraction. So get them high quality food, get them sweating. I don't see kids, so I'm not going to say, okay, here's what I would specifically
Right,
do for
right.
kids, but I would detox them, get their liver functioning well, make sure their nutrients are boosted up, get them the B vitamins that they need, make sure they're on a fish oil and vitamin D, like give them the basics
Yeah,
because kids are pretty resilient. So if you can at least stop poisoning them and get them into a situation where their bodies can do some of the work, it will. I
yeah.
mean, they're pretty great.
I like that. And what I'm hearing as a conventionally trained doctor is I know that we'll do some things to help with the lead removal process with the blood, right? But then what we don't really talk about a lot in conventional medicine is that let's make sure the liver's functioning properly. I mean,
Right.
nobody talks about that. So I think that that's really key, because if we get the things that help naturally detoxify you to work properly, then that's going to clearly allow your body to, even from the perspective of medicine and treatment, it's going to work much better, because now you've kind of gotten the engine of the car running really well. So
Yep.
now let's go ahead, and it's hard to run the race without a really good engine. So that makes a lot of sense to me. And I also think about the cost. So I remember going back to New Orleans. I don't know why I'm in New Orleans today, but when I was in New Orleans, I was uh, I was able to get involved with Amway back then, and it was really interesting because most of the products that they sold had the idea that it was a healthier version or a cleaner version. So, however, just from my memory, there was a cost issue, right? So I'm thinking
Right.
again about communities of color, and if I want to transition from, now for me and my wife, my wife's a pharmacist, I'm a doctor. It's not as much of a burden because of the jobs. We're able to kind of do a little bit better than the average citizen. So when you're dealing with people with limited resources, how much of a barrier is that as it relates to products and things that are less toxic? Or is there a way around, like, has that been a challenge just in your clinical practice? Because I'm sure you see the whole spectrum of people with resources.
Yeah, and Tony, so there's two parts to this. One part is detox itself, like full on formal detox. That's really something you get to when you've mastered what I'll call the foundational things. That's your food, your exercise, your sleep, your environment, that you have gainful employment, that you're living someplace safe. It's like Maslow's hierarchy of self actualization. You really have to deal with safety issues first. Because if you're in survival, you can't
Yeah.
focus on detox. So if you say, okay, we've handled the survival stuff, you know, and then there's a lot of stuff that's really cheap and really accessible. So one, like vinegar, white vinegar.
Yeah.
It's so cheap. You can
It's
get a
so cheap.
jug for like $3.
I know.
And that's in the Boston area. So it
Right.
must be cheaper in Chicago and New Orleans. It's probably a buck in New
Yeah,
Orleans. So
Boston is expensive. In New Orleans, they'll
Boston,
just give it to you.
right? In New Orleans, they're like, take it, 50
Just take
cents,
it.
5 cents, right? So there's a lot of stuff that's a lot less expensive that you can transition into. You don't have to go crazy. I would say vinegar goes a long way to cleaning beautifully. So even starting with that is leveling up, and
Yeah,
that's not expensive at all. And
I
no,
like that.
that um, coconut coconut has a lot of cleaners; those aren't crazy expensive,
Cool.
and
Cool.
so there's a lot of ways to do it, and it's pretty cheap.
I like that. It's kind of funny because I think when you have limited resources, uh, I remember a comedian. I don't know if it was Cedric the Entertainer, but he was like, every time somebody got sick, they say, "Give them some tussin," which is robot. And it's just so funny to me. Give them some tussin, but it's like if something like if you just mentioned vinegar, if it works for a lot of different purposes. And I remember there was like I don't know if it was vinegar or something else, but it was like a whole book written on all the things you can do with it, right?
Yeah, like the 50 uses of vinegar, right? So,
Exactly. So, but I
so
think there needs to be awareness so
yeah,
people know, and then you give them a path to. So I think a little bit knowledge, but a whole lot of behavior once they kind of know. And I know in certain communities also it's like, well, I want the brand name this or whatever, but I think they just need to know, oh, this is harmful, and it's not better to get that shiny thing over here, which
yeah.
is being sold that's better. So I think that's very helpful. So um, I think another thing that I want to level set really quickly is just a little more clarification. Now, again, I'm conventionally trained, so toxin was not a word that we used in my training.
I
And
never heard it in med school.
so there you go.
Ever.
So we're on the same, we have a lot in common, by the way. Conventional training, you've gotten functional medicine, I'm getting it. I have an MBA, as well. So
Oh,
I
you too? I
kind
didn't
of
know that.
a little bit of a,
And my family lives in Chicago, by the way.
amen. So I'll be,
I did too when I was a kid.
oh, there you go. So
Yep, for
a lot of connections, and I love all of those connections. But I'm wondering if you could just talk a little bit more about what a toxin is, because I think that it's such a it's kind of, it could probably be used in a lot of different ways, that term. So just
yeah.
give a little bit more clarity for the average person so they'll understand what they should be concerned about as it relates to a toxin as a general theme.
Yeah, so I don't think we've talked about that I'm the bad news bear, right? I'm never I'm never like, "Oh yeah, eat all you want." So from a really broad picture, kind of anything could end up being a toxin. Too much of a good thing can be bad for you.
Yep, yep.
So let's start with foods. So if you're someone who's got food sensitivities, then eating that food can function like a toxin, meaning it makes you sick. It
Right.
makes your brain not work. It makes your gut feel crappy. So anything can be a toxin. So there's food-based things, and the most common things are gluten, dairy, and sugar.
Mm.
I
Mhm.
think sugar, pardon the expression, sugar is like the antichrist. It's so bad.
Yeah,
So I would say sugar is the biggest toxin, followed by gluten and dairy
yeah,
in the food realm, and then alcohol is actually a toxin. Um,
yeah.
because your liver has to detoxify from alcohol. It is actually a toxin. So that
There goes the holidays.
yeah, happy holidays. Don't have a drink.
That's right.
And then there's toxins like I think you were probably thinking of when you asked me that question, which is heavy metals. So
Hmm.
lead, obviously we've talked about Flint, Michigan, but there's a lot of places in the United States that still have lead pipes.
Mm.
I was horrified when I learned. I mean, it's 20 it's okay. Anyway, I'm not going to get on the soapbox, but so lead pipes is a source of lead, and if you live in a house that was built before 1978, they allowed lead in the paint, and then there was a transition period between 78 and 84 where it was being phased out. So if you live in an older home, or if you lived in an older home and then did construction on that home,
Mm.
either way, you got exposed to the lead that was potentially in that home. And then mercury is the other heavy metal that we focus on. And that's from the amalgam fillings, those silver fillings that we all got when we were kids, or I got a ton of them. And then also fish, heavy mercury fish. So tuna, mahi mahi, swordfish, Chilean sea bass, tilefish. Those are all the heavy mercury, the predator fish, because they've eaten all the fish that have aggregated their own mercury. And now they've just combined it all in one huge fish that you're eating. So all those fish are ways that you can get mercury. Those are the metals. Then there's mycotoxins. These are the toxins put out by molds, and they are in your body and they just keep secreting. It's kind of gross, actually. So you can get exposed to them through food, or you can also get exposed to them through environment. So
All
if you
right.
lived in a house that had water damage, or you have a wet basement, or you live in an old house that's not well ventilated, you can get mold loves warm, wet spaces. So if it grows, you're going to get exposed. And then there's the area of toxins that are probably, to me, the creepiest because they're kind of everywhere. So those are the environmental toxins, and
Hmm.
that runs everything from glyphosate, which is the most commonly applied and produced herbicide that's put on our food. That's a toxin. Then there's also things like the toxins put out from gasoline fumes, or from, I don't know, when I was a kid, I went to high school with kids who would be sniffers, they sniff
Oh
the,
yeah.
right, the glue bottle.
Yeah.
So those are toxic fumes. And then plastic products, microwaving in plastic releases all that, single-use plastic bottles, all the beauty products that we use, nail polish, resins, all that stuff can be toxic for us. And again, in a small amount, if it were just one thing, you could probably deal with it. But
Hmm.
the problem is
It's
you've we haven't even talked about, oh, you're kind of stressed, so now you've shut down your detox
right.
mechanisms, and because you're stressed, you didn't sleep as much,
That's
and
right.
then you ate like crap because you were comfort eating, and you put that all together, it's like a hungry and tired toddler. It's a really bad combination.
Wow. It's so many areas. It's almost like we have to be like John Travolta and put ourselves in a bubble and just
No, yeah.
and that's kind of like, and I hope people listening or viewing are not overwhelmed, because it feels like, because one of the things I still haven't done, because I'm still on the journey, I still got some bottled water in my office, right? So I'm trying to transition to filtered water with the right filter, put it in glass. There's so many layers to this. So I think for everybody
Yeah.
listening, it's an elephant. Again, I say that often. It's just one bite, and then you come back the next day, take another bite of the elephant, but don't get overwhelmed. And
Yeah,
and I
just pick
think
one thing.
just one
Pick
thing,
one thing.
focus on that and make that happen. And I think that won't overwhelm people. And I
Yeah.
wonder if our bodies give us clues, because you mentioned, you were trying to look like me a little bit and lose your hair. I think I'm still cute, by the way.
I wasn't trying to do that. I wasn't
You were
trying.
trying, okay.
As
Just,
good as you look, I was not trying to do that.
that's right. That'll work. I'm good with that. So I'm wondering, other than hair loss and a rash, what we talked about earlier, does our body tell us
Oh
that
yeah.
we have issues? Give some more examples of how our body can tell us we need to detoxify.
Okay, so pretty much anything can be an indicator that you need to clean up your act. And I don't mean to say that. That sounds terrible, right? That sounds
I
like
know.
clean up your act. But anything can be a sign if we're listening. So let's go head to toe. So brittle hair. And by the way, it's all tied in together. So patients will be like, "Can I work on my toxins?" And I'm like, "Yeah, but you got to also work on your adrenals and your gut. Like
Right.
it's all tied in together." So, because how your adrenals are functioning influences how you get rid of toxins, because that influences your gut. And so you have to put it all together. So, okay, head to toe, hair that's not right, falling out, brittle, thinning, not growing back, brain fog,
Hmm.
memory loss, sinus pressure, like
Yeah.
allergies, sinus pressure, thyroid issues, heart palpitations, asthma, difficulty breathing, frequent illness. People are like, oh, I'm always sick. Okay, that's a problem. High blood pressure, diabetes, prediabetes, polycystic ovarian syndrome, anything female oriented, bad periods, too frequent, too heavy, too little, difficulty getting pregnant, difficulty staying pregnant, bad pregnancy outcomes, difficulty making milk, any of that. Gut issues, bloating, gas, diarrhea, constipation, irritable bowel, autoimmune, Crohn's, all of that stuff. Wasting or too much weight, right? You can't
Mm.
lose or you can't gain. Those are problems.
Right.
Joint pain, headaches, migraines. I could go on. Alzheimer's, dementia. All of those are signals saying, hey, something's not right here. Pay attention to me. And when we do the evaluation, we're starting with, hey, let's look at the foundational stuff. Well, the sleep, the stress, the toxic relationships, the hormones, the endocrine system. Let's look at those. Those are the foundationals. And then toxins is around too, because we have to get you sleeping and moving your body regularly. And once you do that, we can look at the toxins. So absolutely, those are cues.
Yeah, it sounds like there are some things we can do. There are some things
Tons.
that you can test. And when you see a patient and you're starting from scratch, is it, I mean, obviously you're going to be a clinician and try to, problem solve and figure out what the specific issue is. But for those who are listening, I'm assuming that there are panels of tests that are kind of, we have allergy testing. Some are just like, we're just going to do food allergies. So what's that? What types of tests are typical? And
Yeah.
is there like everybody gets this test, or is it more specific to what's going on with that individual?
It's always specific to what's going on with someone. However, what's amazing is that there's so much overlap with human beings. We're tired, we have no sex drive, we can't focus, and our gut's bothering us. Like,
Right.
then you kind of
Right.
boil it down. You go, okay, everyone's kind of got that.
That's right.
And then it's pretty straightforward. So yeah, 100% functional medicine is looking at what's the root cause of that. So we're looking at your blood to look at, and by the way, it's a dual track, right? So on my watch, I don't want you getting diabetes, I don't want you getting cancer, I don't want you developing Alzheimer's or another autoimmune disease. So I'm looking at what are the things that are going to put you at risk for that. And then what are the things that might be torturing you now? Are you severely vitamin D deficient? And by the way, you're depressed. Oh, they go together.
Mhm.
We can fix that.
Yeah.
So the nuts and bolts, and we're stricter than what we use Quest Labs. And someone will say to me, well, it didn't come up as abnormal. I'm like, well, I'm stricter than Quest. They're
Right.
looking at whether you're dying, and I'm looking at whether you're thriving. So we're looking at thriving levels for minerals, nutrients, hormones, cardiovascular status. Okay, that's the blood work. And then what's happening in your adrenals? Is your cortisol tapped out or not? Fix it. What's happening in your gut? Do you have food sensitivities? Do you have overgrowth of bacteria, undergrowth of bacteria? Do you got yeast? Do you have crappy digestion? Crappy digestion. Sorry, I don't mean to make a pun. Do you have suboptimal digestion? Do you have imbalances in how your hormones are getting metabolized in your gut and excreted? So we're looking at your stool. Then we
Yeah.
look at your micronutrients. We look at your antioxidants. We're looking at specifically food sensitivities, like through your blood, looking at what's getting through the lining of your
Hmm.
gut into your
Hmm.
bloodstream. And then that's kind of round one. We look at
Okay.
all the things about you. And then round two would be, let's talk about toxins. And that's
Mhm.
metals, mold, environmental, glyphosate. That's all that stuff.
That'll work. That's interesting. Thriving versus dying. That's a theme that I learned in my training,
Mm.
and I noticed that all of their normal ranges were a little different,
Yeah.
a little tighter in functional medicine than it would, and that makes sense. I don't know that I heard it articulated that way, but it makes sense. Like, yeah, we're trying to make sure you live an optimal life and
Yeah.
that you can be healthier and even better at 51 than you were at 41. And I'll be honest, I
Definitely.
definitely feel like I'm better now than I was 10 years ago. So I just
Yeah.
think, and I haven't even done all the things that I need to do. That's the funny part. So I really, that resonates with me as well. And I, I am also, when I think about my personal journey, my family's journey, um, I will probably be a little bit more aggressive than the average person. And I know I'll have people in front of me who are not as aggressive. So, is there recommendations that you make for people? Obviously, if I was just in Flint, Michigan, and my kid had lead poisoning, we got to be pretty aggressive. But then there's others who are doing pretty good, maybe just a little tired. What determines how aggressive you should be about how to detoxify yourself?
Such a great question, Tony. Because I say to people, here's the spectrum, right? Here, here's the spectrum where sometimes the problem is worse than the cure. People walk
Mm,
in, they're sick as a dog, and they're like, I'll do anything to feel better. They're at the end of the spectrum where the it doesn't matter what the cure is, they're going to do it because they feel terrible. And then there's the end of the spectrum where sometimes the cure is worse than the problem. So if you figure that, and that means that like maybe they're a little bit fatigued, but they're overall okay, they're fine. And so I'm going to tread lightly with someone who really feels fine. But honestly, if you've come to see me, you had to wait 2 months to see me, and you had to pay a membership to see me, and I have to take your insurance. So it's not that easy. So you're probably motivated. By the time you come to see me, it's not nothing. You really want to deal with what's going on if you're coming to see me. But if you're out there listening, you go, okay, how do I know if I need to intervene? It's what's my worldview? How do I look at my health? Do I agree with I'm meant to improve like an amazing bottle of wine, or do I think I'm supposed to get worse every decade? And that'll determine what your actions are. And so you have to treat what works for people. So if the cure is worse than the problem, I'm like, don't do the cure. It's okay. You don't have
Yeah.
to. I'll be here. I'm going nowhere. You could change your mind in 6 months. And then
Wow.
the people who are the problem is way worse than the cure, they're easy. They're just going to do it. So
Wow. I like that. So what I'm hearing is you want us to not necessarily drink a lot of wine, but you want us to age like wine.
correct. Don't
Amen.
drink the wine.
That's cool. I got plenty of people who shall remain nameless who, when you talk about alcohol, it perks them up a little bit. Right, exactly. None but love for them, So,
Right? You're like, I'm sending you this podcast because I love you. You should listen to minute 43
minute for, okay.
or whatever it is.
That's
Hypothetical.
about, you're funny. Uh, I'll make sure they get the memo. And I do want to, I think you're a great resource. And again, I'm doing extra credit, so I should send this episode into my teachers so that they'll know I'm thinking functional medicine 24 hours a day. So let's talk about Dirty Girl. The
Sure.
first thing I'm going to ask you about Dirty Girl, uh, I may be dirty sometime, but I'm a dirty boy. so,
I know,
so,
right?
so tell me a little bit about are there things for men in your book? Because it would be, if I'm walking around with a Dirty Girl book, I'm not sure what my buddies would say, but tell me a little bit about, does it hit areas where men could benefit as well first? That's the first question.
So great, Tony, because when we were talking about this title, I was like, I don't want to leave the guys out,
Right,
but the title came from because I said, I'm a dirty girl.
right, right.
And so 100%, there's tons for guys. We do focus a lot more on women because they seem to suffer more.
Yeah.
But I would say probably 9 of the 10 chapters is maybe all of it. I mean, really all applies to men and women
Okay.
equally,
Okay.
you know?
So that's
And
really important. I just
yeah,
wanted to make sure.
absolutely.
Yeah. So, let's think about the big picture. We already know they got great functional medicine clinicians like yourself out there. They got people like me who's trying to integrate it into my convention. I guess I'm like you because that's what you did. You just kind of went there.
Whoop.
You
Yep.
just went there. But you have your book, and people hear this conversation, and if they're like me, they want to take action. So I just want to understand what role, what role is your book going to play? How do we place it in our lives so that we can, and maybe use it in conjunction with a functional medicine doctor, or is there enough there for the basics to start this detoxifying journey? So just give me a feel for what someone who's going to click on Amazon and order your book, what should they expect to get from that?
So the book is a standalone item, meaning you can do all of it yourself. And then there's a point at which I say, even in the book, you need professional help. And I
Right.
don't mean psychiatric. I mean like
Right.
it's really I'm a huge proponent of get the data so you know what you're treating and how long you need to treat for and how intensely. But before you get to getting the data on the toxins, there's so much that goes into detoxifying. So you have to basically detoxify you can do all of the life detox without ever getting data. So you can level up your food, you can level up your environmental cleaners, you can level up your furniture, you can level up your clothing, your beauty products, all that stuff you can do without a provider. And the book really walks you through that. And then we also have a companion guide that we're offering to your listeners actually as a
Cool.
free gift. And that looks at, okay, those are all the action. I bought the book, I read the book, but now what am I doing for water filtration? And where do I go for furniture? And how do I, like, all that information that's in the companion guide with the specific links of, okay, this is a great company and this is a great company. So we're offering that as a free gift for your listeners because we've done hours of work to put that together. And we normally sell it, but we really want to get the word out there. So we're going to give it
Right.
to your people.
Yeah,
So
thank you for that
yeah,
because you're again, I'm still learning. So just to know as we are taking our journey in our home and as we get this message out to others, having some resources that will make it a little easier
yeah,
is really important. I always felt like I remember helping one of my coworkers with what to expect when you're expecting, right? And like this book's been around like the Bible as long as I can remember.
yeah,
But it's just nice to have some guideposts. When do I change the filter in my home? When do I, what about my feet? What kind of shoes should I be wearing? I think that we need stuff to help us
yep.
guide our decision making. Not that it's gospel, but at least gets us going. And if somebody's done the research, why not? So
Yeah, we
I,
did all the research, so you don't
yeah,
have to. But I will say it can feel really overwhelming when you first start out. And
yeah,
I'm a huge proponent of don't do it all at once. Rome
right,
wasn't built in a day. You're not going to be either. So
yeah,
just go easy into this. It doesn't have to, you lived your whole life and you got this far, so you don't have to flip everything on its head overnight. Pick the thing. If you're going to change out your products, do it when they expire so it's not super
hmm,
costly. And when your makeup runs out, every 6 to 8 weeks, you're changing your mascara. That's a great time to change it up.
yeah.
So it's really doing it in a graceful way as opposed to a stressful way because that's worse for you. The goal is not to make you stressed. And I have the book's going to hit you where it hits you. I have a patient who's in a toxic marriage and she's done everything she can to fix her marriage and it's still not working for her. And when we talk about toxic relationships in the book, she said I got to that page and I had to stop reading for a day because I had to digest
Hmm.
that maybe it was time to move on, right? So it's
Yeah,
going to hit you where it hits you and that's okay. It's meant to be taken in little chunks and come back to it when you can.
that's
Do it
right.
as you can.
And I appreciate that. And again, that's why we have a rope and a nest, right? So the R is for relationships, and it's so important that the relationships serve us. I,
Yeah.
in fact, just made a video with my wife's dad, and before we started talking, I shared that he has dementia. But
Yeah.
the point of the video on YouTube, and I think I'll be releasing it. This episode is released after Thanksgiving, but this video will be out on Thanksgiving on YouTube, and the relationship I have with him, even though he's
Mm.
suffering from this condition, being able to just be with him, listen to country music, we sing a little bit in the video, and it's just so his relationship has enhanced my life, and then
Yeah.
there may be relationships in people's lives that are not enhancing. So I really think that's important. And I think, again, we can talk about nutrition all day, but if we don't deal with these other factors, you may not even be able to eat right because your relationship won't allow you
Right.
to eat right. So
Right.
it's like, these things have to be thought of. And I do want to, one more resource that I saw you mentioned elsewhere was this environmental working group
Yep.
.org, EWG.org. Talk a little bit about that resource and what people can learn from it.
Yeah, it's fantastic. So the Environmental Working Group is a not-for-profit group that is all about toxins and how do we clean it up. And so they came to light, I don't know, like 10 years ago, maybe when they
Okay.
came out with the Dirty Dozen, where they talk about here are the top 12 foods that you want to make sure you eat organic because they're the most pesticide contaminated. So they have a Dirty Dozen and they also have a Clean 15, which goes over foods that it would be great if you can get it organic, but if not, here's the ones that are okay to eat not organic.
Okay.
So those two lists on ewg.org are great. And then they've taken it a step further. What they do is they test products and they'll rate it on how high it is on toxicity, cancer promoting agents, allergy causing, scent. They rate it on all these different scales, and they have now gotten to the level where they have products that they've given their seal of approval for.
Mhm.
So that's really become for me a gold standard that uh, I don't look at a product and then go to EWG to see if it's good. I go to EWG and sort by, I just leveled up on my hair stuff and I leveled up on my face makeup. So
Mm-hmm.
I said, okay, what's the best makeup? And
Mm-hmm.
they direct it, and then I go to the company and buy it. So I think that's a fantastic resource. And then there's
Wow.
another site called Think Dirty. It's an app, and Think Dirty is also great to use because you can just plug it in and it'll tell you if it's clean or not.
Nice.
Hmm.
That's a huge nugget. We definitely want to have some links in the show notes for those because, again,
Yeah.
we want to make it easy as people make this transition to avoiding the things that harm them. So that's wonderful. So let's think about your life and what you've done. You have 4 kids. You've doubled up on me a little bit. I got two.
Dude, it's not a
I try.
competition.
I know I can't help but to be competitive.
Like,
So, but it's all good. You win that one, but we're good. So I think about, the nest and rope and the nutrition, exercise, less stress, more sleep, how we think, avoiding trauma, healing from trauma. Relationships, we just talked about that, avoiding organisms and pollutants that harm us. And we spent most of that time talking about pollutants and toxins. And of course, protecting our emotions and our life experience. So talk to me a little bit about your journey over the next 12 months. Where do you plan to put your focus?
yeah, it's funny, we thought writing the book was the hard part. And now the hard part's really getting the word out
Yeah,
because it makes such a profound difference in people's lives when they finally unlock that thing that's been torturing them for
that's right.
years. So getting the word out, making a profound difference in people's lives so that they can level up, clean it up, feel better, have better times in their daily life, their daily experience is better. So for me, that's really, my life purpose is to make a profound difference in the lives of others. And because I take care of women, I don't want to cut the guys out.
Right.
It's really everyone. And I do it via making women's health better because they're the ones who care for the family, make the health decisions, do a lot of the cooking, just do really take care of the nuts and bolts of the family. So making women as healthy as they can be, so their families as healthy as it can be. So that's, I would say, over the next 12 months, that's one thing. And then on a personal level, I'm still in my detox journey. I'm not done. Done, like, I don't know if I'll ever be done, but really to continue cleaning it up and I think I'm in the final leg of getting my mercury out. I
Mm-hmm.
think, fingers crossed, right? I hope y'all pray for me because it's been a long process. And then working on, how do I get even better in my health? What's next? How do I sculpt my body so that it represents how I want? How do I make sure that I source my kids in a way that's going to support them? We're going on a college tour. God
Mm.
help me.
Good luck with that.
Yeah,
Yeah,
right. God help me.
I
We're going to take
remember.
two at once because they're back to back.
That's cool.
So really continuing to evolve and develop, and I would say also have some fun, right? So maybe start traveling again and go somewhere cool.
Cool. I love that. I remember when we did our college tour out east in your neck of the woods. And first of all, there's too many schools out there. So we
There's a
spent a
lot.
week there. It's insane. And they're all wonderful schools. And the irony is that we ended up at WashU in St. Louis. And, we didn't look at a lot of Midwest schools. That's the irony. We spent all this time up east. And I'm so happy because I can just drive 4 or 5 hours to get to St. Louis from Chicago. So it
Yeah.
works out. And now they're driving as we are freaking out. It's like, okay, are you guys there yet? You're kind of not accustomed to your kids. So yeah, that sounds wonderful. And I think all of the things you're going to be working on are wonderful. And I do appreciate this idea that you're going to focus on, adding value to the world. And I agree, just as I've only recently understood and learned functional medicine. And again, that's the foundation of my nest and rope. It's, man, we got to get this message out. And there are so many people, they're just waiting to heal. They need to be coached and supported, but they're just waiting. They're tired of being sick.
Yep.
They want to be here for their families, and there is a better way. And I think that this is awesome. So as we kind of conclude, I want to make sure you give any final concluding remarks you want to give. And of course, let's make sure everybody knows how to get your wonderful book.
Okay. So my concluding remark is, it can feel overwhelming, but you can do it. Go slowly.
Yeah.
And I have a coach. I talk to my coach 3 times a week, whether I need to or not.
Three times
So
a week.
3 times a week, once for an hour
Ooh,
and twice for 15 minutes.
man, that's awesome.
Because it keeps me on the straight and narrow, right?
Yeah,
Like I'm
sure.
accountable. So I would say get a buddy, get a coach, get someone who's going to, or get a functional medicine provider who's going to really support you in this. Don't do it alone. It's not as fun alone.
Right.
Have help. A. And then how do people find me? So our website is fivejourneys.com. And if you'd like to, so the book's on sale. If you if you Google Dirty Girl, you got to get a dirty book. So if you Google Dirty Girl book, you're going to get the book. You'll get my book, not something else.
I'm glad you clarified that. That could get me in trouble.
So, right, you got to clear your browser history after going for Dirty Girl. So go Dirty Girl book or Dirty Girl Trubow or Dirty Girl Toxins. That'll get you on Amazon. You can buy the book off our website too, which is fivejourneys.com. That's FIVEJOURNEYS.com. And if you'd like to get the promotional, the free gift that we put together, it's
Yes.
fivejourneys.com/promo.
Okay.
And then if you'd like to follow us, we're on Instagram, and that's at 5 Journeys Health or Wendie Trubow. We have 2 accounts. I've got my own fledgling Instagram that we're building up. And then we're also on Facebook under 5 Journeys. So there's a lot of ways to participate. And we have a lot of free stuff that, we do a lot of recipes. So it's helpful for people as they're starting this journey because we have a lot of free resources.
Well, I'm so happy when I search your name, I didn't search your book. I've been staying out of trouble because I don't search the title.
Yeah, you're at work, right?
Yeah, I can see the whole internet shuts down, because of what's going on. So thank you. This was fun. Nice to have a laugh, but more importantly, it's nice to provide a path for people to heal. So I really appreciate you. I'm glad we found each other. I'm glad this message is out. I'm so happy I'm learning functional medicine.
Yeah.
And I
Welcome to the
understand.
club.
Yes, I'm a newbie, but I'm getting my feet wet, and maybe one day I'll talk to Dr. Mark Hyman and the rest of the crew, who have been doing this for a little bit longer. So thank you so much, Doc, for
Yeah.
being with me today. Okay.
My pleasure, Tony. Thank you.
Absolutely. Absolutely. So, again, appreciate you. And for those who are listening and viewing this episode, I thank you as well. Until I started my training in functional medicine, I really had no sense of, what a good clinician was because I was just focused on, diagnosing medical conditions and treating them. But now I understand that if I understand what's causing harm and learning how to remove those things, that's a better way to practice medicine. So I'm so thankful that I'm getting that training and that you guys who are listening are learning those tips as well. I hope this conversation intrigued you. And I also hope it encouraged you to start your journey and do some of the things that my doc here has done herself, which is create a beautiful ecosystem for her family so that they can have a body that's nourished, have a soul that's nourished as well. So, as she has suggested, don't be overwhelmed by your detoxifying journey. Just keep it simple and start with one change at a time. In fact, to get you started, we actually recorded a very short video where Dr. Trubow actually shares 5 things that she would recommend you do to start your body cleansing process. So look on YouTube and you'll see that video on my YouTube channel, and I'll make sure to have a link to that as well. So I appreciate you for being with us today, and I really hope that her insights will help you to live the healthy life you've always deserved, and as she has suggested, to optimize your health. So as we wrap up this 75th episode with my guest, I only ask that you continue to be safe, be well, and continue to protect your nest. And thanks again, Doctor, for being here.
My pleasure. Great episode.
Thank you.